Good afternoon, and thank you so much for joining us again for another WellConnect Wednesday. Today is all things Medicare, Medicare Basics, and we have two amazing experts with us today, our connection specialists with our WellConnect Center, which is the sponsor of these WellConnect Wednesdays we've been doing for some time now. So I want to thank you guys so much for being here. They have a presentation for you, but first I'm just going to have you each introduce yourself and kind of explain what you do with WellConnect and how you made your way to CRH.
Hi, my name is Sara Bishop. I am a connection specialist with WellConnect, and I have been there. This is my 7th year. I've been there almost since the beginning. When I started, we were in a building. Now we are virtual. Thanks, COVID. So now we're virtual, and I enjoy all aspects of my job. I actually started out attending classes at WellConnect prior to becoming employed there, and they always said, go find a job where you enjoy being, and WellConnect is that for me, even in a virtual space.
Hi, my name is Courtney Watkins. I've been a connection specialist with WellConnect for a little over a year now. I came here from Mill Race Center previously, so I worked at the Senior Center. And before that, I graduated with a degree in sociology from IUPUC right here in Columbus. I'm super happy to be a part of this WellConnect team. I love connecting people with resources and just being people's easy button to get them what they need.
That's great. So I'll say, ladies, I don't think anybody wakes up and says, I love Medicare and I love insurance and I want to delve into this monster that is that. And you guys, one of the amazing services that we still would like to tell the community about is the navigation services that we have through WellConnect, through folks like you, to actually hold people's hands, walk them through the complicated process. There's a lot to understand. There's a lot of trepidation there, I think, when people are signing up for Medicare. To your points in the description that you provided us, what's the right plan for me? What kind of cost am I looking at? So that's the nature of your presentation today. And like usual, you guys will have a brief presentation for us, and then we will answer your questions at the end of the presentation. They're also going to have a few questions that they commonly hear in case you don't even know what to ask. So I'll let you ladies take it away and load your questions in the comments section.
All right. Well, let's start just with a little bit of an introduction. We talked a little bit about what WellConnect does and what we do as individuals at WellConnect, but we want to let you know that WellConnect offers services to get you connected to primary care providers. So if you don't have a family doctor or a nurse practitioner here in town, we'd be happy to get you connected. Another piece of our job outside of Medicare insurance navigation, we also do the marketplace. And we help folks with some aspects of Medicaid. So Marketplace is coming up for an open enrollment, so I'll just put a plug in there as well. Beyond SHIP, beyond Medicare, those are the types of things that we offer. And when it comes to SHIP, SHIP stands for the State Health Insurance Assistance Program, and it is a not-for-profit organization that we wear two hats when we are counselors. We are employed by CRH, but we are trained and we are accredited or certified through the SHIP program, and we serve as volunteers with that program. Everything that we do through the SHIP program to help you with Medicare is meant to be an unbiased approach. And something I think that's important for people to know is that Courtney and I don't sell insurance. We're not out there making a buck off of what plan you choose. So we're able to give you that information in, like I said, an unbiased way, and it is all free and confidential to you. That's another important thing to know, that our services do not cost you anything. There are some places out there that will do something similar to what we do, but they're going to charge you for it, and we aren't.
Mm-hmm. All right, so like Kelsey said, we are going to be answering some frequently asked questions, so I wanted to go ahead and point those out here first. So I am turning 65 soon, but plan to continue working and keep my employer coverage. Do I need to sign up for Medicare? How soon should I contact you for help? Can I use an HSA account for Medicare costs? When I leave employer coverage, how much time do I have to enroll in Medicare without any penalties? And do I have to have a Part D plan if I have no prescriptions? So we will be answering those throughout the presentation. So first of all, though, who is eligible for Medicare? Someone who is a U.S. citizen or legal resident for at least 5 consecutive years and is one of the following: age 65 or older, younger than 65 with a qualifying disability, or any age with a diagnosis of end-stage renal disease or ALS.
So let's talk about what Medicare actually is. There are 3 primary parts to Medicare. There's Part A, that's going to cover your hospitalization benefits. And then there's Part B. That is for outpatient services, things like physicians' offices, specialists. And then there's Part D, and that's for your drug plans, your prescriptions. And we're going to talk a little bit more in depth about each one of those.
Yeah, so the first decision that you'll have to make is what type of coverage do you want when you're joining Medicare. So you've got 2 options. So we've got original Medicare, also called traditional Medicare, or an Advantage plan. So like we said, we're going to be getting in a little bit more in depth in the following slides, but just as a basic rundown, original Medicare consists of Part A and Part B. You would add a prescription plan and then possibly a supplement, also called a Medigap plan. Whereas an Advantage plan is sold kind of like a bundle deal through different companies. You still have Part A and Part B, but they usually include some prescription coverage for a free premium. And they usually include some extra benefits like dental, vision, gym, stuff like that.
And those are also known as a Part C plan.
Yes.
So we've got all kinds of alphabet
Lots
soup
of
for you.
letters here.
We'll get to another slide where you're really going to be, loving that. So original Medicare is something that is provided by the federal government. It does not pay for everything, and there are limits. There are limits on what it will cover, as well as there are no no limit on the out-of-pocket costs. That's why a lot of people will pick up a supplement, which we'll be talking about a little bit in a few slides back, or forward rather, and the costs for Medicare, with original Medicare, there's an 80% that they pay and a 20% coinsurance that you pay. There are deductibles for hospitalization as well as for the Part B plan. But no matter what type of Medicare you choose, you will pay a share of costs through monthly premiums, deductibles, co-pays, and coinsurances. One of the nice things with original Medicare, though, is that you're not beholden to a specific network of providers. You can go anywhere that accepts Medicare. Part D, the prescription coverage, obviously covering prescription drugs. You must enroll in a prescription drug plan when you're eligible, or you will be penalized if you sign up later. And that penalty is a lifetime penalty. So it's very important that even if you think you don't take any medications now, why do I have to have this? It's important to go ahead and pick up that Part D plan just to avoid the penalties, because they compound. There's a terrible calculation that Courtney and I don't want to have to do for you, and it sticks with you for life. Yeah. That is one way, the standalone Part D plan, or if you choose an Advantage plan, as Courtney mentioned, a prescription drug coverage is usually included with that. Mm-hmm. Most people who choose original Medicare do choose a Medigap plan or a supplement to fill in the gap. That filling in the gap is going to cover the 20%, the deductibles, and some co-payments. It's important that when you are in your initial enrollment period or your special enrollment period, that you go ahead and choose that Medigap plan if you're going to do it, because you have something called a guaranteed issue right during that initial enrollment period. Guaranteed, as it implies, means that they have to insure you through that plan, regardless of pre-existing conditions. And that is very important for a lot of folks. It's also important to note that some people say, well, I'm going to go with an Advantage plan now, and I'll get a Medigap when I need it. Well, when you need it, your pre-existing conditions will be held against you. Mm-hmm. So it's not always good to go that route. You just kind of have to weigh, what are my options and what am I willing to do? Mm-hmm. Oh, and here's the alphabet soup we were talking about. So with Medigap plans, they are standardized, and they are denoted by different levels with letters. Most people choose a G plan. A G plan covers everything except for a Part B annual deductible. So it's going to cover everything that Medicare doesn't pick up, that 20%, everything except for that Part B annual deductible. We used to be able to tell you that that standardization meant that, for example, a G plan is a G plan is a G plan, that any plan you chose, as long as it was denoted by that particular letter, would be the same coverage across the board with whatever company you chose. Unfortunately now, our job has gotten a little harder in helping you decipher that alphabet soup, because they are offering, Medicare has allowed them, insurance companies, because these are private insurance companies, to provide what they call innovative riders, or to have networks affiliated even with a Medigap plan. So we want to, if we're the people you choose to help you go through those plans, we're going to help you look at what these plans actually are going to cover. If there is something like this innovative rider that we've most recently become aware of. But if you're doing this on your own, I will just put those two buzzwords out to you. If you're looking for plans, you might want to ask a lot of questions if you see the word innovative or you see the word select. What does that mean to me?
Mm-hmm. Definitely want to be vigilant. All right, so let's hop over to the other option when you're joining Medicare, and that's the Advantage plan, like Sara said, also called the Part C. So Advantage plans are purchased from a private insurance company, and this type of Medicare, you would have a network of doctors. So you definitely want to keep that in mind if you have a lot of specialists, or if you plan on traveling after retiring, or if you travel a lot now, you want to keep that in mind that you would be restricted to that network of doctors. Most of these Advantage plans include prescription coverage. Usually it's included at a $0 premium, but you would still pay copays to pick up your prescriptions. And then a lot of them include extra benefits like hearing, dental, vision, gym memberships. But you'd want to check with the specifics of the plans, because there are usually limits to those extra benefits.
And I do want to add there that these are the plans that you're seeing advertised on TV. And, God bless Joe Namath and everybody else that's wanting to sell you one. And I'm not anti-Advantage plan, but I do want you to be aware they're also telling you that you might be able to check your zip code. Everybody's telling you to check your zip code. The reason why they're saying check your zip code is that there are some locations where they allow insurance companies to pay a Part B premium for their clients. In the state of Indiana, that is not allowed. So I can save you the time. You do not need to check your zip code. We do not pay that. That is not something that the state of Indiana will pay, or allowed to be paid, I should say.
Yeah, that's a good point. All right, so how much does Medicare cost? So we've got a little bit of a price breakdown here for you, original Medicare versus an Advantage plan. So if you look on the left side, Part A is usually free for most people. It's based on work. I think it's 10 years of work. As long as you've been working for 10 years, Part A is usually free. So Part B is where that monthly premium comes into play. In 2023, the Part B premium is going to be $164.90. This year, it's about $170.10.
It's going down,
so it's
everybody.
Going down for the first time. That's exciting for us. And then, of course, we've got the prescription plan that we would add on, and this varies based on what kind of prescriptions you're taking. So that's something that we would help you with. If you wanted to contact us, we can take a look at those quotes. We look specifically at the prescriptions that you're taking and look at the plans that would work best for you, and find you something that works. And then, of course, the supplement plan, again, optional and varies based on age and sex. But just for example, a woman turning 65, Plan G starts at about $95 a month. And then hopping over to Advantage plans on the right side, again, Part A usually free, Part B $164.90 a month next year. And again, prescription coverage varies based on prescriptions taken, but is usually included for free. But then on this type of plan, you have copays for each service you use. So If you went to your primary care provider, you might pay $10-20. If you went to a specialist, you might pay $40. So there's a fee associated with every service you use. And I like to call these the pay-as-you-go plans.
So what about portability? If you have original Medicare, as I mentioned earlier, that is something that can be used the same across the United States. You're not connected with a particular network. The Medigap plan will travel with you. It is important to note that with both original Medicare and the Medicare Advantage plans, that there is limited coverage for certain things with international travel, but it's mostly near the borders of the U.S., and so most plans are not going to cover that. If you're traveling internationally, you'll want to get additional coverage for something like that. But portability-wise, the Medicare Advantage plans and some Part D plans, they're only going to be available in certain areas. So you do want to, if you're one of those people that winters in Arizona, you're going to want to either choose a plan through a Medicare Advantage plan that gives you a preferred provider network, or choose something like original Medicare with a supplement so that you have that portability.
Mm-hmm. So when do I enroll? Your initial enrollment period, also called the IEP, is your first chance to enroll in Medicare. So your IEP is 7 months and include 3 months before you turn 65, your birthday month, and 3 months after your birthday month. If you enroll before turning 65, your coverage starts the first day of your birthday month. And if you enroll during your birthday month or later, coverage will start the first of the following month.
And enrollment is something that we can help you with. If you're already receiving Social Security income for retirement, your card will come to you automatically. If you're not receiving those Social Security benefits, though, it is something that you do have to apply for, and that is something that we can assist you with, or the Social Security office locally.
Mm-hmm. Another type of enrollment is disability. So if you're under 65 and you have a qualifying disability, and you're receiving those Social Security disability benefits, once you've been receiving those for 24 months or 2 years, you'll automatically be enrolled in Part A and Part B. Likewise, if you're under 65 and you have ALS, you are automatically enrolled the first month you get disability benefits. So another type of enrollment period is the special enrollment period, called the SEP. This enables you to switch if you have certain life changes, such as you retire and leave a health care plan offered by your employer or union, or you move out of your current plan's service area. So the SEP comes into play if you are working past 65. So this is a very common question that we get all the time. You do not have to take Medicare yet if you plan to continue working, but you must have credible employer coverage, and the employer must have over 20 employees. So that's something that we would help you work through. If you've ever got questions about whether you need to take Medicare but you plan to keep working, we can help you work through that. So when you do choose to retire past 65, you've got 63 days to enroll in either Part D or an Advantage plan. So Medicare always starts the first of the month, so it's best to kind of plan your employer coverage ending at the end of the month. That way you have no coverage gap. Another good question to think about is, do you have an HSA? You would want to stop contributing 6 months prior to joining Medicare, if you're joining Medicare after 65, because those parts of Medicare are retroactive. And if you have still been contributing to that HSA, you can get penalized for that later. So you want to stop contributing 6 months prior to joining Medicare. Again, timing it right so there's no coverage gap. Like I said, making sure that your employer coverage goes right up to where your Medicare starts. And it's good to begin the Medicare process at least 2 months in advance. So we always encourage, if you've got any questions at all, contact us 2 months in advance. That way we can get everything going and everything is happening in a timely manner.
Especially if you're going to need to apply for Part A and B, that can, again, timing-wise, it can really throw you off. So please do not wait until the end to do that.
Parts A and B, they kind of start with Social Security, really. So it's best with Social Security office to start things as early as possible.
So the other timeline that you'll want to be aware of, particularly once you've become established with Medicare, is that there is an open enrollment period that begins every year on October the 15th, and it runs through December the 7th. So that is coming up. If you're currently on Medicare, we encourage you to check into your plan. Typically, most people are going to be looking at either an Advantage plan if they're already in one, or they're looking at their standalone drug plan during this time. We use the Medicare.gov site and can assist you in picking plans that are best for your medications. A lot of people think, oh, well, I've already got this one. I'm used to it. I'm just going to stay. There's nothing wrong with that, but you're being a savvy consumer if you check your plan every year. And you're also being wise because depending on your medications, drug formularies change every year with the companies, so you want to make sure that your medications are going to be covered and that they're at an affordable price for you. So those are some things to consider during open enrollment. Please get a hold of us if you have any questions. Now is the time, if you're already on Medicare, for us to help you address that and to run through those things with you. So, are there programs that can help you pay for Medicare? As we've mentioned, there is a Part B premium. That Part B premium for next year is the $163.90, and that premium is sometimes hard for people to come up with. So if you fall into that category or you have a loved one that does, we strongly encourage you to give us a call so that we can help screen you for that, and then either help you apply or help you get connected to an organization so that you can apply. That program does have certain income and resource limits, but we're trained in those limits and we can help you understand whether or not you fall under those guidelines. Another program that helps to pay for costs associated with Medicare, particularly the Part D plan, is Extra Help. That program is through the Social Security Administration, but that is something that WellConnect can also help you apply for. It's an online process. It goes rather quickly and pretty easily. So we would be most happy to help you with that. No problem. The last program that we want to talk about is something called the Hoosier RX plan or program. And that is if you are denied help through Social Security. If you're over income for that program, the Hoosier RX program is something you might also be eligible for. So if you have questions about those, please give us a call. We'd be happy to help you.
All right, so we're going to revisit our frequently asked questions.
Yeah, so thank you guys so much. Amazing points. It's so complicated to think through this whole process, and you guys are there to keep everything, under one umbrella. And so another reminder before we go over the frequently asked questions again, if you do have questions specific to something that wasn't already answered, go ahead and load those in the comment section below. But I'll pivot back to you guys to kind of go back to those, and then we do have a couple more.
All right, so I'll kick it off. So that first question, I'm turning 65 soon, but plan to continue working and keep my employer coverage. Do I need to sign up for Medicare? So no, you don't really need to, as long as your employer has over 20 employees and it's creditable coverage that you've got currently. You can put off Part B. You can put off really Part A and Part B if you want to. Definitely if you have an HSA that you want to continue contributing to, you'd want to put off both Parts A and B. But then when you are ready to retire, that will open up a special enrollment period for you to pick up the parts of Medicare, and that's something that we can help you with.
Absolutely. So how soon should I contact you for help? It's never too early to ask questions. We're always available. If you have questions for yourself, you have questions for a loved one, please reach out to us. But typically, if you're getting ready to retire, the earlier the better, so that we can help you through that timeline, and you don't have to feel rushed in making your decisions. So we say usually around 60 days prior to when you know you're going to retire is a good time to let us know. If you're already receiving the Social Security benefits, as I mentioned, you're going to get that card mailed to you. The Medicare card will come in the mail. It is a paper card. A lot of people end up thinking it's junk mail and they toss it. So please be aware, if you're getting ready to turn 65, watch for that envelope. It's about a half sheet size envelope, and it will have Social Security Administration on the envelope itself. So watch for that. But once you get that card, then we can actually start to help you look at plans. We can help you set up a Medicare.gov account, which we find to be very helpful for lots of reasons. So certainly at least 60 days, but as soon as you get that card in your hot little hand, give us a call.
All right. Can I use an HSA account for Medicare costs? Yes. So not only can you use it for premiums with your Part B premium, your Part D premium, supplement plans, you can also use it for prescriptions, any health-related costs like that. So yes, you can use it for Medicare-associated
You
costs.
can use it, you just can't be contributing to it.
Yes.
You have to use the money that's already in there. So when I leave employer coverage, how much time do I have to enroll in Medicare without any penalties? Again, as we mentioned, you want to enroll. It's typically for the Part D plan, you have to do that within 63 days. So we do recommend that as soon as you know you're going to, or you're thinking about retiring, get in contact with us so we can help you get that ball rolling, so that you don't have any penalties, and more importantly, you don't have a gap.
Yes. And do I have to have a Part D plan if I have no prescriptions? So technically, no, but we always suggest that you should go ahead and pick one up anyways. People that don't have any prescriptions, there's a very low-cost prescription plan that we usually encourage people to just go ahead and enroll in it. This year, I think it was $6.80 a month, and I think next year it's going even lower.
$4.80 is the one I saw.
$4.80. So to avoid a penalty, a lifetime penalty at that, we always encourage you, go ahead and enroll in a prescription plan, even if you don't have any prescriptions, just so you're covered. You never know what's going to come down the road.
Great points. Okay, thank you guys so much again for walking through that. I think, one of the questions that maybe walk us through a typical appointment with one of you guys. How long does it take? What's the process? How do you figure out what's right for the individual you're meeting with?
So it really depends on where people are at in their situation. So if someone calls, I usually try to give about an hour for our phone appointments. So side note, we are doing phone appointments, video chat appointments, and some limited in-person appointments. But so for like a phone appointment, I usually try to give an hour, and I assess to see where are they at in this situation. Are they turning 65 in a few months? Are they telling me that they're going to retire next June? So it depends on the person's timeline. And I usually kind of run through this information. So I usually do like a Medicare Basics spiel with them. And then we look a little bit more in depth if the timeline is there. So we can go ahead and look at some prescription costs. We can go ahead and look at some supplement plans. And then it's up to them. We try to take every person is different. So we try to, figure out what's important to you and what type of plan you feel like you might fit in, and help you along the way.
Yeah, and there are two tools that we access that you also have access to as a community member, but we are proficient in, well, I like to think we are proficient in how to use them, and it's something that we can educate you on how to use them, so that really all we're about is enabling you to do, an advocate for you to do what you need to do and your decisions. We're just helping you with those. So the two tools that we typically use would be Medicare.gov. That is a tool that you can even begin to look at now. I highly encourage you, and I may have said this earlier, but it bears repeating if I did, that you only use sites that end in .gov, because if you're turning 65, you're already being inundated with mail, I'm sure, about plans and what should you choose. So if you get online and you Google something, you search for something, you're going to get what you asked for. So I would really encourage you to do the .gov. So we do Medicare.gov. That is where we can help you set up an account if you have your Medicare card. If you don't have a Medicare card, we can still help you run your prescriptions to see what plans might be best for you. But we also use a site that's on the IDIOI, the Indiana Department of Insurance.gov, and that there is a site available that will allow you to search the supplements that are provided or available, I should say, in the state of Indiana. That helps you to avoid having to contact individual insurance plans because we can give you those quotes. And again, as I mentioned, Courtney and I don't have a nickel in the dime. We're not getting any kind of commission. We're not getting sales from that. So we're going to present all of your options in one meeting. So that is something that I feel like is super valuable so that you're not having to spend time looking all those individual things up or calling and asking all these individual companies. And we can provide you with a customized personal review from that site.
Oh, absolutely. That's great. Great insider information that you guys have that you just wouldn't even think of. One question, how long does the application process take?
The application for Medicare itself, like for Part A and B?
Probably.
Yeah, that would be my guess. So with Medicare A and B, that is something that can take up to 60 days. I've seen it take that long. It can be processed more quickly, but again, thanks to COVID and the pandemic, we are dealing with some tighter turnarounds for people. So it really is just better to, and when you apply, let's say, for example, you're getting ready to turn 65, obviously, no matter when your application date is, it's not going to start until you turn 65. But if you are retiring, you can request in your application what you want the start date to be. And if you are retiring and you are not receiving those Social Security benefits yet, then they are going to require some paperwork to prove that you've had creditable coverage leading up to that point. So that's something that we are happy to help you walk through. It's not a horribly difficult process, but it's something if you have help, it's nice.
Yeah.
Sure, yeah. Okay, and then are there specific health issues or medical issues that are better for certain options or plans?
Yeah, kind of. So the first thing that comes to my mind is if you're someone who maybe you have a lot of specialists that you see, maybe not all of them are in Columbus, maybe you've got one in Indy, maybe you've got one in Bloomington. That might be a case where a network of doctors might not work for you. So we always check networks. So when we've got someone who's interested in Advantage plans, we always get on the websites, we check doctors to make sure as many doctors as possible are in that network before we help them enroll. So if we've got someone who sees a lot of specialists that we just couldn't make the network work, in that case, maybe Original Medicare, where you have no networks, might be a better choice. And again, we would do that case-by-case basis and make that decision alongside, help make that decision easier for you. That's the only thing.
Well, and I think, too, one thing that I would say is that if you know it's not in your budget to have an additional cost for a supplement or a Medigap, that and you're over income for some of the Medicare savings programs, then if you have an Advantage plan, although there are limitations to it, there are kind of some fail-safes in there for you because the Advantage plans do have an out-of-pocket maximum so that there is a cap or a limit to what you would be expected to pay for your health care in 1 year. So if you were to have Original Medicare and be in the hospital multiple times, you're paying that deductible every time you go in. If you have an Advantage plan, there's a limit to how much you can be expected to pay in a year. Some of them are $3,500, some of them are $5,600. It really, again, it all goes back to what's your situation, and that's why it's hard for us. We try to keep it as basic as possible because really it's going to be dependent on your situation. And some people like to say, oh, well, I've always had XYZ through my employer, and I just want to stay with that company because it's all I've ever known. That's fine, but that may not be the best deal for you. We just kind of give you a fuller picture, or my husband always uses this prescription plan. I'm going to use that prescription plan. Again, it's so specific to your medications that it's important to really look at the full picture. And while I'm thinking about medications, I do want to bring up, and I don't think we touched on this, another piece of good news that we learned recently at our fall training is that insulin is going to be provided at a $35 monthly copay through all of the drug companies. So if you are a diabetic or dependent on insulin for other reasons, just know that which was so cost prohibitive is becoming more manageable for people, and we're super excited about that.
Gosh, yeah. That's amazing. That's amazing. What an advocate you guys are. I mean, to keep track of all of this. So, we always say when we're talking about primary care providers, take questions. You guys are the same way. Make out a list of questions. Don't be afraid to ask you all those things. And then also, you're coming to the table with these things that may not even register with some people. So, just again, cannot stress the importance and just the value that you guys bring through that service for people. So if you have questions or want more information, feel free to reach out to our connection specialists. Thank you. There you go. And of course, we always like to send you to the site, crh.org/WellConnect, where you can find that information. We also have the number here on the screen and a direct email. So, and I assume people can email their questions or whatever to that.
Absolutely.
Your patient privacy is the most important thing. So you can rest assured that is going to be protected throughout this whole process. So I think that is all we have right now. So thank you again so much, Sara and Courtney, for joining us, and thanks for joining us today. As always, we do follow up with these questions. We do post this to our website, so it's out there. So if you did not make the live session and you're viewing this another time down the road, that information will be available, and we continue to answer those questions and utilize Sara and Courtney to answer your questions if they come at a later date. So thanks so much.
Thank you, Kelsey.
Thanks.